Welcome to the Tobacco Online Policy Seminar TOPS. Thank you for joining us today. I'm Cessation, a tobacco researcher at Ohio State University. TOPS is organized by Justin White from University of California, San Francisco, Catherine McLean from George Mason University, Mike Pascal at Georgia State University, and me. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable comments. Please keep the comments professional and related to the research being discussed. Comments that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your comments are very much appreciated. This presentation is being video recorded, and portions of the recording and presentation slides will be made available on TOPS website, tobaccopolicy.org. I will turn the presentation over to today's moderator, Catherine McLean from George Mason University, to introduce our speaker.
Today, we continue our spring 2023 season with a single paper presentation by Matthew Carpenter entitled The Impact E-Cigarettes on Smoking Cessation, Results from a Large Randomized Nationwide Clinical Trial in the US. This presentation was selected via a competitive review process by submission through the TOPS website. Dr. Carpenter received his PhD in clinical psychology from the University of Vermont in 2003. And relocated to the Medical University of South Carolina, MUSC, in Charleston, South Carolina, where he currently is a tenured professor, serving as co-leader of the Cancer Control Program within MUSC Hollings Cancer Center. His primary research relates to tobacco use across a broad methodological continuum, from lab-based studies of craving and nicotine dependence to small and large-scale clinical trials for smoking cessation, to public health policy for effective tobacco control. He has led a number of large national cessation trials, including a large cluster randomized trial in primary care. He leads a robust program of research on alternative products, including clinical trials of e-cigarettes. He is an innovator of methods for remote clinical trials. Throughout, Dr. Carpenter is keen on trainee development, encouraging a long line of trainees to develop their own science. He has served on a number of NIH study sections, including several as chair. Most recently, Dr. Carpenter has serves as a standing member of the NIH CSR Advisory Council. Our discussant today is Justin White from the University of California, San Francisco. Dr. Carpenter, thank you for presenting for us today.
Well, thank you for having me. I want to confirm that you can see my slides.
Yes.
Great. Thank you so much, Catherine, and all other organizers for inviting me here today. I'm thrilled to be here to present the results of a trial that we completed in the fall and have been sifting through results ever since. As a starting point, I will say that you could see my funding on the bottom left and also my disclosures over the past 10 years. The most relevant of which is the top one, where we have received e-cigarette product that we have purchased through Enjoy. And obviously that has relevance to today's presentation. So my presentation is focused on adult smoking cessation, which we all know is not the entire story. So it's a little bit of a one-sided presentation, and I fully acknowledge that. It's also a clinical presentation. I know this is a policy seminar, and I think there are policy implications to what I am presenting, and maybe we can get into those implications. And lastly, I have a few slides that have what I consider to be main outcome data from our trial. I'm happy to share them here, but I am asking that we not disseminate beyond this hour because the manuscript is not yet out in print. Okay, so a little bit of background. I think most researchers agree, perhaps not, obviously not all of them, that e-cigarettes offer a reduced harm alternative to users as compared to combustible products, especially if for those who completely switch. E-cigarettes are not safe, and I want to make that clear, but I'm in the camp that says they are safer than combustible cigarettes. They can suppress nicotine withdrawal and craving in ways that nicotine replacement therapies cannot. As you may be aware, there are a handful of clinical trials that have been suggesting that e-cigarettes help smokers quit and may even be superior to NRT. The Cochrane review from last year was the most definitive on that statement. There has been a lot of debate on these issues, and I think there was a good counterpoint recently, or it's in press in addiction that you can see there. I'll also draw your attention that the existing clinical trials are of a certain type. They are cessation focused in that they take in smokers who want to quit, give e-cigarettes to help them quit, and are have instructional, purposeful, guided interventions to achieve cessation or reduction. Okay. So that is a background to our trial, and I was very proud of the day that we came up with an acronym. We call it the CONNECT trial. And I want to acknowledge my collaborators here at MUSC, Tracy Smith, Mike Cummings, Jen Dane, Kevin Gray, Graham Warren, as well as others around the country, including Amy Walquist, Ted Wagner, and Maciej Gonovich. My research staff has been outstanding throughout, and obviously this study could not have been done without them. And I thank also my interns and postdocs who have contributed to this part of the trial. So we got a study logo, and that helped with a lot of our branding, and you'll see that throughout my presentation. So as I said, the best evidence to date, and I consider that to be randomized clinical trials, suggests that e-cigarettes could help smokers quit. As I said, most of that evidence comes from outside the US, and it's based on prescribed or instructional use, something along the lines of use this e-cigarette to help you quit or reduce. Very few trials in the US, and even fewer with naturalistic intent. So you might be interested in our earlier trial from 2017, which was basically a smaller version of what I'm presenting today. It was a precursor to what I'm presenting today. So our intent was to have a randomized design which minimizes selection bias as to who does and who does not use products across a range of smokers, and I'm including folks who are and are not motivated to quit smoking. And we offer them the opportunity to use e-cigarettes for whatever reason they wish, for whatever purpose they wish, with minimal guidance from us. It's as naturalistic as possible. So we randomized people who smoke to receive product in a 2-to-1 ratio, and that product was an Enjoy tank-based system. And the control group was a group of folks who did not receive the chance to try the product. We sent enough for 30 days, split over 2 shipments with a choice of flavors. You can see those flavors there. And this wasn't our exact phrasing, but it was pretty close to it. Use it however you wish, including not at all. So you could reduce, you could quit, you could use it during smoking restrictions. It's completely up to you. Now, I want to be clear that we provided product for free, and I know that that is not naturalistic. So what we can say is that we're looking at uptake and outcomes when cost is not a barrier. We had daily diaries for the first month, and then periodic phone-based assessment for 6 months thereafter. As I said, we purchased product from Enjoy. They did not provide any financial or any other support to us. We recruited participants from 11 cities across the country. So as a naturalistic study, we can first look at uptake and patterns of it, and trajectories, frequency, quantity of use, adoption, those types of things. We can look at attitudinal and subjective responses. We can look at behavioral outcomes. And I'm going to be focusing on the first and the third, uptake and behavioral outcomes, and the latter being reduction, quit attempts, and cessation. We did have a name for biological biomarker collection, including cotinine and NNAL and CO, and I'll talk more about that in just a moment. You'll see the asterisk, and you'll see why. So this was the general design. Our participants were adult smokers with minimal history of vaping. And that's a fluid concept because the prevalence of use is changing so frequently. And as I said, we took folks across the full spectrum of motivation to quit, although we did stratify on it so that there were equal numbers in both groups. A 4-week sampling period and periodic follow-up out to 6 months. So we wanted to get 660 participants, and of that, we had a subset of participants, 120 of them, who would be local to the Charleston, South Carolina area for the purposes of biomarker collection. However, COVID got in the way. So we actually got 638 total participants. We're pretty proud of that. The only reason we stopped is because we ran out of product. Couldn't get it anymore. Of the 120 that were local, we got 105. But with COVID and university shutdowns and our staff was working from home, we couldn't have lab visits and that kind of thing. We had very poor data on biomarkers. So that's why the asterisk is there, and that's why I'm not going to be presenting those data today. So our baseline characteristics, these are our demographics. I'm not going to go through line by line, but you can see that we have a fairly good heterogeneity here. I'm proud of the fact that we've got racial diversity, socioeconomic diversity, and no group differences between the two groups. So that's participant demographics. Here we have participant smoking history. So cigarettes per day, right on track with national averages. Age started smoking about the same, and you can see other characteristics at baseline. In terms of motivation to quit, we have ladders that we use, 0 to 10 scales. You'll see that smokers were right about in the middle, and had a little bit less confidence in their ability to quit smoking. Again, excuse me, no baseline differences between groups. And therefore, what I'm about to show you for the rest of the presentation is not going to have any covariates for the reasons that you see here. I'm going to pause right now, and before I get into results, ask if there are any questions that we may have.
Yeah, thank you so much. I'm actually going to take over for Catherine as moderator, at least for now, because there's a fire alarm in her building, so she had to step away. Hopefully she'll rejoin us later. So I am the discussant though, so I will allow myself to ask the first few questions. And so I do think this is an important study, so thanks for sharing it with us. Definitely looking forward to reading it when it's out. I guess to start off, maybe you could say a bit more about where and how participants were recruited, and also especially because you mentioned that it overlapped with COVID shutdowns, over what time period recruitment occurred?
Yeah, so I don't have the exact dates. We started in, I think, sometime in 2018. I'm forgetting the exact month. We ended in March of 22, but final follow-up was September of 22. So basically 6 or 8 months ago was our final follow-up. In terms of recruitment, what we did was a lot of social media throughout the US. So we chose 11 cities, and I don't have the presentation, but I do have the cities on a map somewhere. And we chose those for geographic disbursement throughout the country, and also to try to get some demographic diversity. This is a topic for a separate conversation, but we do have methods in our recruitment strategies to really try to optimize diversity, at least demographically. And I could say more about that, but that's a separate conversation.
Yeah, I guess just sticking with one other point on recruitment, how did the number of participants enrolled differ across the 11 cities? Like, did you try to recruit sort of evenly? And I guess, did you factor also that into randomization in terms of like stratifying by city, or
no?
Or was there the good balance across arms by city?
So that's a good question. And what we did, I didn't want like 200 people coming from city A and 10 people coming from city B, because that would be bad science. So we capped each city at 80. And I forget how many, what the performance was of each city. Certainly have those data somewhere. But we said, once we got to 80, we stopped. And in some places, I think we had been in a city for like 3 or 4 months, and we were at 60, and we just said, let's move on. because it was just, we had been there for a while.
And one last question before I turn it to audience questions. Just to be clear about eligibility criteria, these are people who wanted to quit smoking. Were there other sort of ways that you targeted different individuals?
No. I want to be clear. So there was no requirement to want to quit smoking in this. If you had no motivation to quit, you're still eligible if all other criteria are met. Motivation to quit, it was assessed, but was not a requirement. Okay,
great. That's helpful. Okay, so turning to some audience questions. So one question is from Norbert Schmidt. What is your definition of cessation? Is it smoking cessation or total nicotine abstinence?
So we will be reporting on both. You'll see. I have trajectories later on where you'll see people who met both, but for purposes of my cessation outcomes, I'm going to be talking about combustible cigarette cessation. Very good question.
Okay, and then Jonathan Folds asks, do you know anything about the PK of the e-cigarette that was being used?
Oh, Jonathan, you're putting me on the spot. No, not off the top of my head. I do not. I'm sure we have it in our file someplace. I'm sorry.
Okay, Amanda Holm asks, how did you select the particular ENDS product for this study?
Yeah, so we wanted I wanted a tank device because at the time, now remember this study was designed in 2000 or conceived in 2017 when the landscape was very different back then. So I wanted a tank-based system because I believe that there was more efficient nicotine delivery with those as opposed to the earlier generation Ciga-like devices. I also wanted a tank that was not modifiable. Okay, so I didn't want people to be able to pour it out, add more in, liquid, those types of things. Because we're mailing it to the home, we wanted to have some precautions around that.
Great. Stan Glantz asked, how did accounting for covariates affect the overall results? I know you mentioned you're going to be presenting unadjusted results. So
I have unadjusted results today. We're working through what will be included as a covariate and what will not. But I have unadjusted results today. As you can see, there's no baseline differences between the groups. This slide that's right in front of us. So we did achieve randomization pretty well.
Okay, just one or two more, and then we'll have you go ahead. So how did you know the people in the trial only used e-cigarettes and not combining them with smoking? Did you do carbon monoxide recordings? And I think there's something we'll get to.
So right. So remember, this is a nationwide study. The options for remote carbon monoxide collection were not what they are right now. We did add them in late into our study. I think in like 2021, maybe 2020. I'm forgetting exactly when those methods really became available and the devices became reliable and valid in our view. But at the outset of the study, we didn't have that.
Okay, maybe one last question. So this is from Akshika Sharma. She asked, were participants allowed to pick only one e-cigarette flavor from the options, or could they switch during after the?
So you could choose up to two. So we had 2 shipments, and on shipment 1 you can choose up to 2 flavors. On shipment 2 you can choose up to 2 flavors, including a switch, and I'll show you data on that.
Okay, feel free to continue, and we'll answer the other questions if we have time.
Okay, all right. So moving on. So now we're getting into uptake here. So this is a little bit of a complicated slide, but I'll first draw your attention to the bars, okay? And that's the left-hand y-axis. The bars are the percentage of participants who are using at all in the week preceding each assessment. In the 4 weeks that we gave it, it was around 68 to 70% of e-cigarette group participants used it. So not everybody used it, and it was naturalistic. About 30% didn't use it in any given week. And the control group did allow, they were allowed to use their own product if they wish. We assessed it, we tracked it, but they got it on their own accord. And you could just see their naturalistic uptake on their own in the gray bars. On the right-hand side, looking at the lines, is the number of days in that week that the individuals are using. And this line does include the non-users. So there's a lot of zeros in there, okay? So you have a range from 0 to 7 days, and you can see that at their peak, they were using it anywhere from 4 to 5 times 4 to 5 days per week. On the right-hand side, now this is only among users, and remember, we have very few controlled e-cigarette users, but we had a few. Among those users, how many times a day did they sort of use it? A puffing episode, if you will. And we had a objective way that we described that. And they're using it about 8 times a day, 6 to 8 times a day. And notice that that did not differ between the groups. So we did increase uptake, but I don't think we increased amount of use. Somewhat different slide, but now I'm going to take away the non-users, and I have these dashed bars. So now we're getting rid of all the folks who have no use, and obviously frequency of use goes up. Okay, because now everybody's above 0. So notice that among the people who were using e-cigarette in the e-cigarette group, about 6 days a week at max. In the control group, fewer of them, about 4 to 5 days per week. Yeah. So 2 different ways of looking at e-cigarette uptake. Flavor selection. This was asked earlier. Now this is a little bit of an unfair comparison. We have 3 fruit flavors. There's 5 flavors altogether. The 3 fruit flavors, that's a mouthful, are all aggregated into one here, and we can split them out. Interest in tobacco flavoring was low and decreased. Same with menthol. Fruit was more popular. Again, that's aggregated across 3 flavors. In time, we will be able to look at outcomes as a function of flavor. We're not there yet. You know, here, this is okay. So we have confidence to quit, upper left, motivation to quit, lower left. Heaviness of smoking index is a measure of dependence, and cigarettes per day is another measure of dependence. And you can see group by time interactions for all of those. Okay, and again, confidence and motivation are on a 0 to 10 scale. You're not seeing a huge difference between the 2 groups, but you are seeing a different trajectory. Okay, I'm going to dig in a little bit more on dependence on the next slide, because we assessed dependence using the Penn State nicotine dependence scale. I hope, Jonathan, I'm giving the right name to that. And if anybody was paying attention to the SRNT listserv about 2 weeks ago, I asked a question in regards to this slide. You know, how do you bring in abstainers and whatnot? Anyway, I'm not going to get into that discussion right now, but this is a plot of e-cigarette dependence and cigarette dependence. So comparing the 2 solid bars, blue to orange solid bars, you're looking at cigarette dependence over time. One group, and that's an interaction. One group decreases greater than the other group. Okay. Now, if we compare the orange solid to the orange dashed, now we're looking at a within subjects comparison of cigarette dependence to e-cigarette dependence. Okay, so within the group, your dependence on one versus your dependence on the other. And you can see that e-cigarette dependence does increase, but it never surpasses what the levels were for cigarette dependence. Okay, I'm not plotting e-cigarette dependence in the control group because there were so few users of them. It just doesn't make sense to plot dependence among 20 to 30 people. So so you see significant group by time interactions. So yeah, that's that. Okay, now this is getting into a little bit of the trajectories. So we have the ability to look at trajectories. Now, I'm simplifying the time points here. We did have people at 1, 2, 3 weeks follow up, but I'm just going to ignore those for now and show you week 12. I'm sorry, 4, 12, and 24. Excuse me. And in those at those time points, we can classify our participants into one of 4 groups. They're either mono smokers, mono combustible smokers. They're mono vapors. They are dual users, or they've completely quit both. And this is kind of hinting at the questions that were asked earlier about, well, who falls into where, and are they quitting both products? So this is the conceptual map of what we can be doing, and I'll show you the data the next slide. So, each Each group can subdivide, and each of those can subdivide even further. And all of those buckets are defined by what you were using in the prior 7 days prior to each of those interviews. Okay, here we go. I almost hit mute. So a couple things of caveats. All the percents are based on a denominator from the previous step, and with missing data, the last observation was carried forward. I want to be very forthright about that. The last observation was carried forward for anybody who's missing. So this is just the e-cigarette group, 427 folks. Okay. You can see where they fell out at week 4, 12, and 24. Notice most of them went into dual users, stayed dual users, and stayed dual users. I'm going to talk more about that in just a moment. But now let's look at, of the week 4 mono smokers, you can see where they eventually came out at week 24. And sorry for the confusion here with the coloring, but the green are the people who are completely not smoking combustible cigarettes. The turquoise, if that's the color, those are the people who are not using either. Okay, so of mono smokers, 3% achieved complete abstinence of combustibles, and 4% achieved, complete abstinence of everything, and 4% achieved abstinence from combustibles. Of week 4 mono vapors, 30% achieved complete abstinence from everything, and 74% achieved abstinence from combustibles. Of the week 4 dual users, 6%, 5.7 became complete abstainers from both, and 12% became abstainers from combustible cigarette smoking. So you do see a lot of dual use here. Let's talk more about that in just a moment. Right now. So did we create dual users? Yes, we did. However, let's look at those dual users and see if they reduced their exposure to combustible cigarettes, because that's what counts, right? So among the dual users at week 4 or 12 or 24, about a third of them cut their smoking by half. Among ever dual users throughout follow-up at all, there was a 40%, 40% achieved 40% of those of ever dual users achieved a 50% reduction. And overall, there was a 36% reductions in cigarettes per day. And even among the people who never quit by half, or never reduced by half, I know I'm getting a little confusing here, even among those who did not reduce by half, and there were 200 of those, there was 14% reductions in cigarettes per day. So we are getting substantial reductions in cigarettes per day among dual users. But let's go a little bit further. Let's look at the outcomes of those dual users compared to the other groups at the final follow-up. So again, let's take everybody's status at week 4. And again, we had 68 mono smokers, 43 mono vapors, and 315 dual users. One person, if you remember, had quit everything. So among those 3 groups, you're seeing where people look at the far right, 30% of the mono vapors achieved abstinence from both products compared to about 5.7 of the dual users. And you could see if you combine it all together, you're seeing a pretty decent rate of abstinence from combustible cigarettes. So if you were to add the second and the fourth column together, you would get what about I can't do the math off the top of my head, and I have it somewhere. 2%, let's call it 6% of the mono smokers achieved combustible abstinence. 74% of the mono vapors achieved combustible abstinence, and 11.7 of the dual users achieved combustible abstinence. So we had a greater proportion of dual users achieving abstinence than the entirety of the control group. Let me repeat that. Greater proportion of dual users achieving abstinence than the entirety of the control group.
Dr. Carpenter, sorry to interrupt you, just reminding you, we have about 15 minutes left.
Yep, and I've got, I think, 2 slides left. maybe win. So the findings complement the existing clinical trials of e-cigarettes, which again were primarily cessation focused. So I don't know if our study design is truly reflective of real world. That might be a stretch. We did give it away for free, of course, but it is reflective of a scenario in which people decide on their own how they're going to use these, even if they're going to use these. So it's completely unstructured and unguided use. So our results showed that unguided, unstructured use led to increased quitting across a range of outcomes, whether it's quit attempts, cessation, floating abstinence, cigarette reduction, you name it. Effect sizes of those outcomes were comparable even among people who did it and did not want to quit. Dual use was the predominant outcome, but moderate reduction in cigarettes per day, even among those groups. I've already mentioned the limitations COVID got us in terms of lack of bioverification. We do have manuscripts in development. If you're interested in joining us towards those goals, please contact me because we can't do all this on our own. And then I am presenting at a SRNT symposium. I know Jonathan Fools is here. He'll be presenting with me. I think Eli Klemperer might be on the line, and Ted Wagner might be here as well. So we'll be presenting at podium session number 2 next Thursday. Come join us then. This is my last slide. E-cigarette trials should be balanced with the equally important goal of prevention of youth and initiation. My presentation was one-sided, as I told you at the outset. This is not a tug of war where only one side wins. Okay, that's a bad analogy. This is a balance of how do we get e-cigarettes in the right hands of people who might benefit from them, but out of the hands of kids. And I firmly believe that we can do that. So there, I will stop. I've got nothing else to show. I don't know if you want me to stop sharing my slides or what I should do here, but the floor is yours. Thank you.
Oh, thank you so much. Whatever you'd like to do, if you'd like to stop sharing, that's great, Dr. Carpenter, or we can keep the slides up.
Sure, yeah.
We do have a few more questions, but I'll give our discussant, Justin, a moment if you'd like to make some comments.
Yeah, thanks. So I think you made you presented some persuasive data that abstinence definitely increased. And I think when I'm trying to think about the overall public health impact of the intervention, I'm focused a little bit on that group that had the large reductions, greater than 50% decrease in cigarettes per day, especially among dual users. And I think part of it depends on sort of like what ultimately ends up being the long run outcomes for that group. And I know that it does persist, or it seems to persist that 1/3 of people who decline, have those large reductions in cigarettes per day through 6 months. I'm curious if you think that is sort of sufficiently long to be following up this group, or maybe your understanding of the literature, whether we should worry about any sort of reversion towards increasing cigarettes in the long run or that sort of thing.
Sure. So longer follow-up would definitely have been better.
Okay.
The granting gods, are such as they are that just couldn't do it, given the time and budget constraints. But, absolutely would have been better. Whether there would have been reversion, perhaps. But listen, had we gone out 1 year and I showed you similar or somewhat different results, then the argument could have been made, well, what would happen if you go out 2 years or 5 years? So there will always be the potential for reversion, but 6 months is a standard outcome for clinical trials in our field, and it'll just have to stand at that.
Yeah, fair enough. So I thought that the increase in motivation to quit and confidence to quit that you showed, those time trends, where especially in the treated group, being that increase was interesting. And I think it fit with the overall results, the main outcomes that you showed, that, trying the e-cigarettes maybe gave people more motivation to quit, more confidence to quit. Is that sort of, would you give any other interpretation to those patterns? And yeah, I guess that.
So Justin, if you allow me just a quick point of correction, and I know, it's a great question. I just want to be careful that I'm not calling this treatment or an intervention. It's neither. I was careful not to use those words if I could. I called it the e-cigarette group. I don't consider this an intervention. It certainly wasn't an intervention trial. Okay, to your question, which was, motivation and confidence to quit. Absolutely. That is a process, a mechanism. We can do mediator analysis of whether changes in those process variables led to the outcomes that we did. When I've done NRT sampling studies, if you know my work, I've done large-scale NRT sampling studies, doing a large-scale varenicline sampling study. I've done a small-scale varenicline study. Those are the types of things that have shown to be process variables. There's other process variables too, like risk perception and liking a product and those types of things. But great, yeah, those are mediators.
Yeah. Last point, and then we can turn to audience questions. So in terms of other analyses, I'd love to see. One would be just thinking about how outcomes might vary based on e-cigarette regulations in the given city. I imagine there's some variation across the 11 cities, and it'd be interesting to see how that might have modified participants' beliefs, or how that interacts with, I guess, participants' beliefs about the risk and as well as norms and potential use within, especially within this sort of experimental setup of your study. It would be really interesting.
I absolutely agree. Environment matters. Environment is relevant to policy. Policy matters. And we will have the ability to look at whether any of the effects vary as a function of city. We only had 11 cities, max of 80 participants each. So it'll be a little bit tough, but it's a good question.
Yeah. So thanks. I'll turn it back.
Thank you.
Catherine.
Thanks, Justin. We have some great questions here from the audience. A question from Jillian Walker. Do you know if the respondents used a product with the same more or less amount of tobacco if you did not supply it after 4 weeks?
Okay, if I understand the question, did they if they used it beyond 4 weeks, what was the product that they used?
Yes.
So one of the things that we asked at all time points is, did you use? And if the answer was yes, we asked them, did you use what we gave you, or did you use something on your own? And if they used things that they purchased on their own, we dug a little deeper in terms of what type of device you bought, what nicotine concentration you bought. But so we have the ability to look at those data. We haven't yet. My sense is that the numbers will be low because I think, in fact, I know that adoption of the products on their own was low. I mean, it wasn't nil, but I don't want to get the number off the top of my head because I might be wrong, but it was lower than what I would have expected based on our prior work, that people were not going out and buying their own, which suggests that maybe they were continuing to use the things that we gave them.
Great. Thanks so much. I'll give you 2 questions here together just to try and get through all these really great questions from the audience. Shannon Miller has a question on the issue of e-cigarettes being safer than smoking. Shannon writes, I am not yet aware of any studies long enough to conclude this yet. Starting to chip away at this and some comments on some potential damage of e-cigarettes. So I'd love to hear your thoughts on that.
Yeah.
And then Benjamin Toll asks, have you looked at quitting by cigarette dependence?
Great question. So great question, Ben. No, we have not. Pen's a colleague. He's probably right down the street from me. To the first question about safety of e-cigarettes, I'll say what I said at the outset. They are not completely safe. They do have known constituents which are known to be harmful at trace levels. So I think it's a little bit of a misguiding statement, if I can say that, to say that there are harmful ingredients in e-cigarettes. There are, but you've got to quantify that relative to combustible e-cigarettes. And it's at much lower levels, trace levels, it's been often said. Has there been the 20-year study looking at e-cigarette users and mortality? No, they haven't been around that long. That would be a great study to do. Now, it's going to be confounded because many of the e-cigarette users were prior smokers. So how would you separate the two? But it's a great epidemiological question. I am of the camp that e-cigarettes are safer, even if they are not safe.
Great. Thank you very much. A couple of questions here from Christian Science. What was the nicotine strength of the e-cigarettes you provided subjects?
Yeah, okay. That was on my slides. Let me just go up. I don't know if you're asking me to quote my... Almost there. 15 milligrams per milliliter of nicotine.
Great, thank you. And just another question from Christian. I believe potentially you touched on this, but if you could clarify, when you carry forward missing observations, which you noted, how might this bias your estimates towards or away from your central findings?
Very good question. That I would probably need to consult with my statistician on. I'm not sure I can give the best answer to that. And I don't want to speak beyond my expertise.
Okay.
It was a discussion point. We just said, well, do we drop them out? What do we do? It was just a decision that we made, and it's imperfect at that.
I just my one quick comment that I'll add. I'm not sure. Apologies if when I was away, I missed you saying this. But have you thought of potentially a bounding exercise where you might assume sort of like the worst case and then the best case scenario based upon your empirical distribution for those that were missing?
Yeah, we could do something like that. Yeah.
Great. Just a couple more questions. The audience has been extremely enthusiastic, so thank you so much. Richard Proven asks, was there any indication of satisfaction given by the e-cigarette group? Nicole Krebs asks, did you have any issues with mailing e-cigarette products to participants?
Yeah, great question. So we did ask about liking and taste and palatability. We haven't analyzed those data yet, and it's a great paper to come. Be very interested in those. Another moderator or mediator, perhaps. Mailing. Tough issue. We did not have issues doing it. Obviously, this was IRB approved. All the labeling was generic. There was nothing on the box that said tobacco, e-cigarette, nothing like that. We did assess at each follow-up whether if the product had been used by anybody else, recognizing the imperfections of that. And we didn't have any problems with that, actually.
Okay, great. Very interesting. Jonathan Folds asked, based on your experience in sampling studies, how would you compare the boost in quitting smoking from sampling e-cigarettes in this trial with prior trials with sampling other products, for example, NRTs?
Yeah. Very good question. So Jonathan and everybody else, it's a great question. I actually had a slide that I took out that has done that. So I took it out because it was an unfair comparison because of the way the data were analyzed. However, as you were saying, I have done now 3 large-scale NRT studies with very similar design. Mail it out, naturalistic, use it as you wish, including not at all. I have done a pilot study of varenicline sampling along the same lines, use it as you wish, including not at all. And I have an ongoing study of varenicline versus NRT versus neither sampling, 600 people around the country, all naturalistic, all use as you wish, all comers taken in. So the question is fair. The early analyses suggested that the effects were stronger in the e-cigarette conditions, but I put a lot of caveats in that because we weren't really comparing apples to apples with those analyses, but you can bet that we will be.
Thanks so much. So we are getting close to time, but let's try and do just a couple more questions. I'll combine them together. Stanton Glantz asks, any chance of getting back to people now to get longer term follow-up? Peter Selby asks, did the active group also augment their use of e-cigarettes with additional e-cigarettes vaping devices?
Yeah, so Peter, minimally, to your second question about uptake of their own, there was some of independent uptake. I have some numbers here that I don't want to quote because I might be wrong. Stan, more distant follow-up would be great. An attempt to follow up with them. We have not. That would require an IRB. It would require some budget, the above. I'd love to do it. It would also mean like going back to people who were recruited back in 2017 and 18 and those types of years. So we have not.
Great. Okay. Thanks so much. And thank you all to the audience. I think we have run out of time, but these questions will be shared.
Thank you so much. I enjoyed it. So next week, SRNT.
Thank you very much. We're out of time. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of over 200 people for your participation. Wow. Have a top-notch weekend. Thanks, everybody.
Thank you.
Bye.
Bye.